Good morning to everyone and welcome to today's session. We have three fighters in the game, Rajita, Zulfikar Ahmed and Vai. And those who else want to participate, you all can be able to enter the link, the payment link which is being shown below, and can be able to join the game and also call 900868 So all the 13 online students, thanks for joining. And those who have bought the ticket and joined the game, most welcome. You are going to definitely have an exciting journey across the day. We have 4 parts of this discussion. 10 to 11:30, we have part 1, 100 questions out of 300 full-scale NEET PG paper. And once more, at 12:30, we have the part 2, another 100 MCQs. Totally 300 MCQ full-scale paper is being divided into 4 quizzes. Then in the afternoon, you have part 3, part 4, post-lunch, 50-50 questions. So the idea is, a lot of people join the online full-scale grand test, but they don't take the test. They go into postponement syndrome. So why don't we make it a game? Ideally, learning is supposed to be a game. And every game is supposed to give you some prizes, gifts, incentives that will stimulate our mind to participate in the game. And every game challenges our mind. A quiz tournament challenges our mind. And every time we are challenged, we are either topping the game or we are learning something out of that. And we should be inspired by every quiz tournament to really go back and study those topics where we are getting really bruised back in the online MBBS.com video library. So with that preamble, let's start the game. And those who could not buy the ticket, you still have time. Anytime you can join the game. 100 rupees ticket is applicable for all the 4 shows. You just pay 100 rupees, you can play 4 quiz tournaments, complete 300 MCQ game, right? So to watch is good, but to play game is great. So it's a great experience. So I encourage you to buy the ticket and join the game. Now, Doctor, let's make the great beginning. Yes. The 3 warriors, Rajita, Vai, and Zulfikar Ahmed, are you ready for the game? Yes, sir. Let us start. Epithelial component of the thymus gland. From which pharyngeal pouch is it derived? Is the favorite question of the examiner. Punch. Which? Excellent. Only one of you correctly answered. I hope the other 2 have gone into the sleep mode. Please join the game. So it is the pharyngeal pouch one. That's what you need to remember. Rajita, Vai, Zulfikar, all the 3 mistake. Oh my God. No worries. Now, the next question. Mullerian inhibiting hormone in the fetus. From where is it produced? Is it subtly Leydig or anterior pituitary? From where? Very good. 2 of you answered, but only one of you is right. That is subtly cell. That brings Y to the top over the Zulfikar Ahmed. Now, about the right atrium, what is an incorrect statement? So you should know what is crista terminalis. Is the opening of the inferior vena cava into right atrium, is it valveless? So the correct answer is option B is wrong. So the right atrium receives coronary sinus. It contains the embryological remnant of the foramen ovale, and the crista terminalis separates the smooth walled part of the part from the rough walled part of the right atrium is what you need to remember. So when you look into the phone, the questions, all four options you can very clearly see, right? So now, the next question. Middle phalangeal flexion. Middle phalangeal flexion at the proximal interphalangeal joint require the function of which structure? All these structures are required for the middle phalangeal flexion at the proximal interphalangeal joint. No. You require median nerve, you require ulnar nerve, you require flexor digitorum profundus for that, not the radial nerve, is what you need to remember. Good. That brings Rajita into full energy. Excellent. Now look. The next question. So, what is the anatomical level of various structures? This is one of the most standard MCQ in a NEET PG exam. You have to be 100% sure on. Which anatomical structures are correctly matched? Except. Very good. So you should remember, bifurcation of the common carotid artery happens at the level of C4. The start of the trachea happens at the level of C6. And the sternal notch and the arch of aorta is at the level of T2. But thyroid cartilage is at the level of C4, C5. That is the point. Let's see, doctor. All the three of you are clean bowled. I'm happy about it because it is an inspiration for you to go back to the onlinembbs.com video library and quickly master all anatomical levels. Very, very important. Okay. Now, breast is supplied. What are the blood vessels that supply the breast? Is a very important question. So you should know arterial supply of the breast. You go to FMG, All India PG, NEET PG. This is the most standard question. Very good. So I am able to see 13 online students. Very good. So those who could not be able to pay the ticket to join the quiz, you still have time. It is just 100 rupees for the entire 4 shows. Just by paying 100 rupees, you can get and play all the 4 shows of the full-scale grand test, the cheapest full-scale grand test ever offered by anyone in India, along with discussion, right? So please take every opportunity to call our helpline and buy the ticket. Otherwise, you are having the link below, which you can be able to take the link and make a payment and still join the game anytime, right? Now, very good. Lateral thoracic artery, internal mammary artery, superior thoracic artery, they all supply the breast is what you need to remember. Wow, that keeps Rajita on the top. Correctly answered this question. Very good, Rajita. Now, The next question. A person falling from the building held a tree branch, as shown in the figure. So, because of that, will arbor palsy occur or clumsy occur? If so, then what is paralyzed, what is not paralyzed? You have to be 100% sure. Only one of you correctly answered. Paralysis of the deltoid, which is supplied by axillary nerve, doesn't happen. Whereas pronation of the forearm, inability to initiate abduction of the shoulder, decreased sensation of the medial hand, they all are typically seen in clumsy, is what you need to remember. Clumsy is a lower brachial plexus injury. And what is the root value of axillary nerve, doc? C5, C6, and axillary supplies the deltoid is what you should remember. Now, the next question. Posterior cutaneous nerve. Posterior cutaneous nerve of thigh does not supply the skin which is overlying what? So it supplies the middle aspect of thigh, posterior inferior aspect of the buttock, scrotum, not the front of the thigh. It supplies popliteal fossa and back of the thigh. Back of the thigh and medial aspect of the thigh are supplied by the posterior cutaneous nerve. Only one of you correctly answered. That makes Rajita to shoot up like a rocket. Very good. Now, doctor, the next question. What are the boundaries of femoral ring? Femoral ring is the question of the examiner. So you should remember femoral vein, inguinal ligament, lacunar ligament, they all form the boundaries, but not the femoral artery is what you need to remember. Now, very good. We have Amit Jain, Yugender, Bobby, who are all online. Why don't you guys join the quiz and play the quiz? It is not very costly. It is only 100 rupees ticket to play the quiz, but you will get that adrenaline rush when you are competing with everyone and looking at the leaderboard where you are standing in comparison to others. Now, Doc, the next question. During the incision and drainage of the abscess, which is being shown to you, which nerve is injured? Which nerve is injured? So, you should be quite sure it is the inferior rectal nerve which get injured in that procedure, which is being shown to you where there is a drainage which is being done. So that keeps Rajita, why have correctly answered. Now, the next question. The lower border of costodiaphragmatic recess is at the level of which rib? 6th, 8th, 10th, 12th. Very good. It is at the level of the 10th rib. So you must know all the boundaries of the costodiaphragmatic recess, one of the high-yield question. The longest vein in the human body. Very easy question. The longest vein in the human body. Very good. It is the long saphenous vein which is considered to be the longest vein in the human body? The lymphatics of the ovary, where do they drain? Is it para-aortic, interiliac, extrailiac, obturator? Where do they drain? Is very important. Excellent. It is the para-aortic group of lymph nodes into which the lymphatics of the ovary drain is what need to be remembered. That's good. Why is dominating the game compared to Rajita, who is only about 7-8 points behind? No worries. If Rajita punches the answers faster, she will go to the top. The entire skin of the face is by the trigeminal nerve, except the skin overlying the angle of the jaw. So, what is it supplied by? This is one of the oldest stock question. Good. Great auricular nerve is what you need to remember. Wow, both Rajita and Y, both of them are right. Half-Boyer cells, what are they associated with? So you have to be very sure about the half-Boyer. So half-Boyer are the placental villus macrophages of the fetal origin. That's a point you need to appreciate. Oh, this is very sad. They are the placental cells, which are macrophages of fetal origin. They are present in placental villi, is what you should remember. Now, the next question. In a healthy 70 kg adult, the plasma volume is found to be 3000 ml. Hematocrit was 40%. So what is that formula? Unless you don't know the formula, it is difficult. So you should know the formula. Total blood volume is equal to plasma volume divided by 1 minus hematocrit. So here hematocrit is how much? 40%, that means 0.4. So 1 minus 0.4 is 0.6. So total blood volume is equal to plasma volume by 0.6. So here, how much is the plasma volume given? 3000 ml. So 3000 divided by 0.6, and that gives you the value of 5000. That gives the value of 5000 ml is what you need to remember. Now, so the carry home message is total blood volume is equal to plasma volume divided by 1 minus hematocrit. If you know the formula, you will answer. If you don't know, you are gone. So that is important. Doesn't matter. You can go back and anytime do the revision. The minimum stimulus strength that produces a compound action potential in a nerve or muscle. So you should know the definition of Riobase, Cronaxi, everything. So that is called Riobase. So what is Cronaxi? The minimum distance, the minimum duration for which a stimulus equal to twice the Rio base need to be applied if you want to start an action potential. Twice the Rio base is called chronaxin. Okay, so you'll remember the definition of Rio base and chronaxin. Only Y correctly answered. Inhibitory interneurons in the spinal cord. What is it release? What is that neurotransmitter which is being released? Good to see Manasvi. So it is the glycine which is the inhibitory interneuron. Now, doc, impulses from the Golgi tendon organs, they pass to the inhibitory interneurons in the spinal cord via which type of nerve? 1B, 1A, 2A, C fibers. You have to be very sure. Good. So it is the 1B. 1B is what you need to remember. And the Golgi tendon organ. So what is that layer of the cortex where specific thalamic afferents they end? Is it the layer 6, layer 4, 1, 2? So once more, the layers of the cerebral cortex is a favorite topic of the examiner. So Harsha, if you have paid, please join the quiz. Please give a call to our helpline 9000-868-356. Okay, and join the quiz. Yes. So, doctor, the next question. Under normal physiological conditions, the changes in the stroke volume, they're often secondary and decided by the changes in what? What decides? So you should know the Starling's law, right? So it is the inotropic state, the contractility, which is a deciding factor, is what you need to remember. So Harsha, you can still join. Please give a call to 9000-868-356. You can get the link to join the quiz. So now, the next question. A patient with hypertension, hypokalemia, hypernatremia, this should make you to remember one simplest, that means mineralocorticoid is excessive, that is making sodium retention, potassium loss, leading to hypokalemia. Very good. Two of you are right by recognizing the Conn's syndrome. A patient with a plasma sodium 156. 156 is the higher side of sodium. Urine osmolality is 52. So what is the likely diagnosis in this given case? So it's a classical case of diabetes insipidus, where you are able to see lack of ADH will make water lost into urine. That makes plasma become concentrated, urine become diluted. Now, the next question. Migrating motor complex. What is correct about it? If you are on the quiz game, you can see all the 4 options. Migrating motor complex. So, even if extrinsic innervation to the gut is removed, still this migrating motor complex can be produced because it is something which is intrinsic to the gut. Now, there is a decreased FSH and LH. So, actually the full question is available in the slide. You can, on the phone, you can expand the slide. Still, if you give GnRH, LH-FSH is elevating. That means the problem is there at the level of the pituitary infundibular stalk. So in acute mountain sickness, what is the earliest symptom? Yes. Earliest symptom of acute mountain sickness. So all these most commons, earliest, you have to be very sure. Headache. Most of you thought nausea, vomiting, right? No. Headache. Simplest question. Normal GFR is how much? I know all of you will answer correctly. Correct. 125 ml per hour. 125 ml per hour. Where is the pneumotaxic center located? In which part of the brainstem? Excellent. It is the dorsal pons where it is located. Y is right, even Rajita. So what is the best test for the GFR? Well, this question frame was wrong. Yes, inulin clearance test. So in the enteric nervous system, how many neurons are there? Pretty easy question. How many neurons are there? 100 million. 100 million neurons are there. So what is an initiator codon? Good to see 20 online students. So today I am sitting here to give you company, to play the entire 300 MCQs full scale grand test. You should make it a habit. Only if you make it a habit, it is useful, because a lot of you join for the full scale grand test, but you don't really solve it, for whatever the reasons. But I want you to make it a practice to sit 3 hours and solve the paper. So it is the AUG, which is the initiator codon. So the mutations which are leading to 1 to 3 base pair insertions or deletions, what are they called? What are they called? Wow. They're all called frame shift mutations. So adenylate cyclase activity typically becomes stimulated by all these hormonal actions except very good. When epinephrine acts on beta 1 receptors, epinephrine acts on beta 2, or whenever the glucagon, in all these scenarios, adenylate cyclase, cyclic AMP is considered to be the secondary messenger. That's good. Y is really rushing fast on the top. Let us see. About lipid metabolism, once more, if you have done this question wrong, you need to go back, and there is a beautiful discussion in the online mbbs.com video library. You have to do a revision about the lipid metabolism. So you need to remember that the free fatty acids are bound to the serum albumin, true. And the adipose tissue triacylglycerol is hydrolyzed by the hormone sensitive lipase into free fatty acids and glycerol. And the hormone sensitive lipase is activated by glucagon. That is also true. Okay? So, but you need more extensive review of this very crucial topic. Very good. Harsha, joining the game little late, but latest arrival. I'm so happy that you joined the game. Even the other online students, take every opportunity to join the quiz and play with other players. Get a sumptuous practice for the preparation to exam. Now, Ketogenic amino acid. Which one? Ketogenic amino acid is it isoleucine, leucine, tryptophan, tyrosine, which is ketogenic amino acid? Wow, that's good. Leucine. Leucine is the ketogenic amino acid. So you should know that list, doctor. If you have done this question wrong, वो list पकड़ के बैठना. Okay? Yeah. Now, J6PD deficiency. What does it lead to? I mean, glucose 6 phosphatase deficiency causes what? Glucose 6 phosphatase. One guy gotcha 4 base McCardle. So all these glycogen storage disorders, all 4 of you are right. Very good. So that brings Harsha into the game. Chitin, what does it contain? Wow, very good to see 23 online students. Excellent. Please invite more of your friends. Please play the quiz. Good to see Mohan Babu. Bibek Raj. Yes. So it contains beta 1,4 bond. That's the point. Only Zulfikar Ahmed has correctly answered this question. These are all true about vitamin. Actually, vitamin C, except. What's your answer, doctor? Vitamin C, except. Very good. Vitamin C leads to scurvy. Vitamin C participates in hydroxylation reactions, which are very important for the steroid synthesis. Vitamin C acts like a reducing agent. They're all true. Okay. So one question in NEET PG exam invariably comes from the vitamins. Only Zulfikar and Y are able to correctly answer this question. Now, which is not formed by tryptophan. Tryptophan is important for most of these things, but we get easily mistaken. It is needed for niacin, melatonin, serotonin, but not melanin. Melanin is not tryptophan. Melatonin is by tryptophan. Very good, Harsha. Thumping performance. So let us see whether the other partners can manage to take Harsha head on. Now, the rate limiting enzyme of heme synthesis, not home, heme. Good to see 24 online students. So it is the ELA synthase, which is the rate limiting enzyme of the heme synthesis. If all 25 of you are inside the quiz and punching the answers, it would have been a great pleasure, but you need to buy the ticket to get into the game. So you have the link below. Please go through you can still join the game by buying the ticket. Now, same charged two proteins, separation, how do you do? Same charged separation of two proteins, how do you do? Is it Cifadex, agarose, DEAE cellulose? Once more, chromatography is a favorite topic of the examiner. Cifadex. Now, good to see Maunika, Vivek Raj, and many more who are all online. What is the main enzyme responsible for the activation of the xenobiotics? Interesting question. Xenobiotics. Good. Cytochrome P450. Dehydrogenases of the HMP shunt, they are specific for what? HMP shunt. FAD, NAD, NADPH or FMN? Pentose phosphate pathway. Very good. NADPH. Now, the dietary cholesterol, everything you should know about all this bloody stuff called lipoproteins, LDL, VLDL, HDL, chylomicrons, everything, doctor. If you have done this question wrong, you should that should be an important alarm for you to go back and do that revision in the biochemistry. Only one. Actual answer is chylomicrons. Oh, sorry. Dietary cholesterol, no, not triglyceride. Okay. It is LDL, correct answer. So those who did wrong, you have to seriously think. So I can only see Rajita correctly answered this question out of all of you. So good, Rajita. Good going. Now, Wernicke encephalopathy biscuit question, easiest in the world. It is due to thiamine. All four of you correctly answered. I think the world's easiest question. But don't worry, actual NEET PG exam also will have almost 150 questions like this only. It is not really that complicated. HIV positive patients show increased incidence of what? Increased incidence of. So all the AIDS defining illnesses, everything you need to get sure. So Kaposi, pneumocystis, mycobacterial, they're all typically wherever cell-mediated immunity is involved, they're increased. These are all gram-negative. Once more, if you have done this question wrong, you need to seriously go back to Microbiology in the online mbbs.com video library and do a revision. These are all gram-negative, except simplest question. Only two answered this correctly. Corynebacterium is not gram-negative, but Bacteroid is Campylobacter, Klebsiella. They're all gram-negative. And that only two are Harsha and Y has correctly answered. Which is a branching filamentous organism? Branching filamentous organism. It is a nocardia. It's a biscuit question. Good. Which is a pleomorphic organism? Pleomorphic organism. Chlamydia, only one of you right. So microbiology, chota tukde questions, but you need to be very sure. Now, which organism has no cell wall? I think all of you will correctly answer. No cell wall. Good. 4 of you are right. That is mycoplasma. Now, which will not stain gram stain because it is intracellular organism out of all this? Yes. Punctured answers. Excellent. Legionella pneumophila. Only one of you is right. And that is Julfica. Very good, Julfica. So we took almost 40 minutes to finish about 50 questions. So this is going to be a double Sholay movie. Yeah. But the point is, if it is only left as an online test, you don't get motivation to answer. But we are all playing together means you feel quickly get challenged yourself to play the game. That is my whole point of driving you, right? So my job is to drive you to read, not just to teach. There's nothing to teach actually. You're all smart enough to learn. So Psittacosis, Levinthal, Colles, Lily, bodies. You all need to give me a feedback. Did you like to be handheld by somebody to make you go through all the 300 questions and play the game by giving you company? Did you like this idea or not? Please punch the your opinion. I like to listen the criticism, compliment and comment with equal energy, because guys like you have helped me to become a good teacher. by giving a good feedback. So, a honest feedback. Are you liking this method? Harsha is saying, sir, we need more hard questions. Milega, hard milega, kyun nahi milega? But hard will only, actual entrance exam is not at all hard. You see the recent AIMS paper or JIPMET or NEET PG last year paper. They're all simple questions for the people who prepared well, right? So please give a open-ended critics and opinions. Yes. So Monica says we will add more clinical oriented questions. वो कर सकते हैं, उसमें टेंशन नहीं है, करेंगे. So I mean, the basic premise. Around 1,000 students, when they pay the fee for the online full-scale grant test series, I will see, not only now, in the past also, 10-15 students really take paper. मगर 1,000 क्यों pay कर रहे fee? You are only philanthropically funding the teacher, honestly. So that means teacher is failing to inspire you to take the full-scale grant test. So that is the reason I want to handhold you and make you to study every day. So if you are saying teacher also sitting with you for 3 hours, 4 hours, you will feel, oh, let me play the game. Okay, so that is the idea. Very good. Man is a secondary host for malaria, not a primary host. So Harsha and Y Zulfikar, absolutely right. Sputum examination. It is useful in all these scenarios, except so it is useful in ankylostoma, strongyloides, Westermaniae, Paragonimus Westermaniae, which lead to pseudohemoptysis. So trichuricid is not useful. Okay, that's the point. I'm not really going into a great detail because this session is not meant for that. This is for quick testing, knowing where you are good, picking up some topics, going back and doing the revision. Every Sunday full-scale grant test. So what is the natural habitat of Cystozoa? Where does it stay? What is its address? Good. But all these places, urinary bladder, vesical plexus, portal, pelvic, everywhere you find Cystozoa. Good. Rajita is closely reaching Y to become the topper. Harsha even joined a little late, but latest arrival. So what is malignant hydatid disease? Is it the malignant change? Is it multilocularis? Or is it in the immunocompromised? When do you call malignant hydatid disease? Good. It is a multilocularis, which is called malignant hydatid disease. Only Harshavardhan and Y could answer. old senescent geriatric RBCs, how are they mainly attacked? Typically, in which type of malaria are they attacked? Senescent RBCs. Yes. So typically in quartan malaria, oh, none of you could answer it correctly. So see, Harsha, the real complicated questions are simple questions most of the times. Not always clinically oriented. Actually, clinically oriented are more easier questions. So every day you have multiple quizzes across the day. So I'm inviting many other teachers also to conduct rapid fire quizzes. You can be able to play, recharge yourself every day across the day. Every Sunday, we will also have a full-scale grand test and discussion. So I think instead of putting a 25-50 rupees per test kind of a thing, it is better we create one month membership, right? So you pay, for example, say about 1,000 rupees, then you will get access to all the quizzes that are conducted, including the grand test quizzes across the month. I think that become more easier, so that the people who subscribed with that kind of a quiz participation monthly fee, 1,000 rupees monthly is more easier for most of you. I can also invite a lot of other teachers to come and do a rapid fire quizzes more often. I think that's much easier option, right? Instead of every time running around paying that 25-50 rupees, getting the link and all that. Instead, the link can be sent to all the monthly subscribed students. That's more easier. So heating and subsequent plating is a method used for isolating Clostridia. Please don't forget. That's good. Now, about toxoplasmosis. Are you disconnected or no? How come? Am I available for everybody, or is the broadcast okay? Can you please punch, online students? Okay. Toxoplasmosis. It is the IgM antibodies, not the G, which are diagnostic, because IgG crosses the placenta. In adults, toxoplasma is asymptomatic. It is an anthropootic disease. Encephalitis is an uncommon complication in immunocompetent individuals. Now, doc. Oh, is AHA slides not working? Oh, it's working. By chance, if it is not working, you can once more come and join using the same link. You can rejoin. Sometimes if your connection is gone, you can once more come and rejoin. Now, doctor. 3 of you are right. Phase typing is used in the classification of staphylococci is what you need to remember. Very good. Phase typing. Now, what is the most sensitive test for the antigen detection is an important question. Most sensitive test for the antigen detection. Very good. Two of you correctly answered radio immunoassay is the most sensitive test for antigen detection is what need to be remembered. In the carriers, staphylococci are found in which site? Is it throat? Is it nose? Is it skin? Anus? Where are they found? Yes. Where are the staphylococci found? In the throat, nose, and skin. Staphylococci are the carriers, not anus. Good. Now, Landsfield classification. What is it basically based on? It is based on what? Landsfield's classification of the beta hemolytic streptococci. Easy question. If you answer this wrong, you are in amoeba stage in microbiology. Oh, two of you are wrong. We have two amoebae. So it is based on polysaccharide capsule. Y and Zulfikar Ahmad, you really need to bottle up your microbiology. You are truly in an amoeba stage. One question is enough to say how good and bad you are in a given subject. That's the whole purpose of a good diagnostic test. About the streptococcal sore throat laboratory diagnosis, what is a wrong statement? Three of you right. So throat culture is the standard diagnostic test. Most laboratories, they inoculate the throat swabs on the 5% sheep blood agar containing trimethoprim sulfamethoxazole. And the culture of single throat swab on a blood agar has a sensitivity of 90 to 95%. Group A are not inhibited by, they're not bacitracin sensitive. So that is very important. Novobiopsin sensitivity, bacitracin. These two are favorite questions of the exam. A man on return from travel to China, China mat jana. With pain abdomen, jaundice, ultrasound shows a worm in the bile duct. So, what would be the organism, doc? Yes. Good. Clonorchis sinuses is what you need to remember. Bupropion. Everything on antipsychotics, antidepressants, tricyclics, everything. I hope yesterday a good number of you enjoyed 30 MCQ rapid fire pharmacology quiz. After that, what have you done? Are you inspired to go back and do the revision? So it is not used to treat bulimia, because bulimia's main treatment is what? Behavioral cognitive therapy, cognitive behavioral therapy. Antidepressants don't have much of a role. So bupropion is a weak dopamine norepinephrine reuptake inhibitor. It decreases the craving, especially nicotine, tobacco smokers. It is used for taking care of the craving, and is best avoided in the patients who are at the risk of seizures, is what you need to remember. Now, morphine is used cautiously in patients with which situation? So you have to be very sure. Complications of morphine, contraindications of morphine. So asthma, liver failure, impaired renal function, you have to be cautious while using the morphine. About pentagocin, what is the wrong statement? Pentagocin. So you have to be very sure. If you answer this question wrong, simple point, you should go back to opioids classification. Favorite topic. Pentagocin is the agonist on the kappa receptors. It is a weak antagonist on the mu receptors. It precipitates a withdrawal syndrome in a morphine abuser, but it cannot antagonize the respiratory depression of morphine. That's the point you need to appreciate clearly. Though it is an antagonist, no doubt, still it cannot antagonize the respiratory depression caused by the morphine, is what you need to remember. All the four of you are clean board. Now you have seen no Harsha. If we complicate the questions unnecessarily to show that we will conduct a very tough paper, students unnecessarily go into depression, which I don't want. You know, the purpose of a mock test is to have the test as close to what examiner conducts. Not the toughest paper, most critical paper, no. That is not the idea. Okay? See, if we give a little tough question, khatam, all 4 wickets gone. If I conduct all 300 questions stuff like this, you will be disappointed. A whole week you will be crying. I don't want to do that, because my job is not to make you immunocompromised. I want to make you immunocompetent and give you a more realistic paper similar to examiner. Okay? Yeah, some of our quizzes, rapid fire quizzes, I will try to give clinical vignette based, image based and all that. Yeah. Now, about ACE inhibitor, which can be given OD. OD. Ramipril, there is only Rama. Rama has only one patni, one arrow. 1 day only. 1 day dosing. Okay, once a day dosing. See, all the 4 of you got clean board. Little complicated will make you clean board. That's the whole challenge, right? So we will only purposefully put not more than 30-35 questions. What precipitates digoxin toxicity? This is a standard question. If you have done this question wrong, I'm going to cry. Except, easy question. Hyperthyroidism, absolutely. So steroids, hypoxia, renal failure, they all precipitate the digoxin toxicity. Immunosuppressive, that blocks the action of the complement. So invariably NEET PG exam में one monoclonal antibody based question आएगा. Okay, so what is your answer? That blocks the complement action. Eculizumab is the one which blocks the complement. Carbimazole is associated with everything on propylthiouracil, carbimazole. You should know the differences. Classical question. Whoever answers is a brilliant, super duper student. How? None of you answered. Oh my God, I am a bit disappointed. I am crying. I am sleeping. I am crying. Scalp defense doctor. So, only Harshavardhan did it right. Excellent. Now, these are all hallucinogens, except hallucinogens, except so except so you should remember methylphenidate, except. Good. Two of you correctly answered. That brings Harshavardhan climbing very fast. All generation of cephalosporins, complications of cephalosporins, you ought to be very sure. Come on, Daco. What are third generation? Which are anti-anaerobic organisms? Which is anti-pseudomonal? Hey, only one is right. Ceftazidime, third generation. Cephalosporin, anti-pseudomonal. And cephalosporin causes disulfidone-like reaction with ethanol, is what you need to remember. Only Zulfikar is lucky to correctly answer. Good, Zulfikar. 75th question, we took 75 minutes to reach. Whoa. So, these are all alkylating agents, except. Punch your answer, doctor. These are all alkylating agents, except. Wow. Only two of you correctly answered. Once more, You need to go to the classification. Zulfikar and Harsha. So 5-fluorouracil is called anti-metabolite, doctor, not a alkylating agent. So all these antiretrovirals inhibit P450 except P450. Oh, efavirenz. What will you remember about efavirenz? Efavirenz lead to suicidal depression, right? So also lopinavir, ritonavir, sakinavir, all which are the microsomal inhibitors is what you need to remember. Now, anti-cancer antibiotics. What is wrong? So, dactinomycin, you should know, dactinomycin with methotrexate. It may be curative for both localized and gestational choriocarcinoma. Mitomycin is used along with vincristine, bleomycin in treatment of squamous cell carcinoma of the cervix. Bleomycin is not, it is cell cycle specific. Fatafat bolo doctor, cell cycle non-specific. Cyclophosphamide, chlorambucil, cisplatin, actinomycin D, and L-asparaginase, they're all cell cycle non-specific. That is, they kill both dividing cells and resting cells. Whereas cell cycle specific, which one is G1 specific, vinblastine, which is synthetic, S-phase specific, methotrexate, 6-mercaptopurine, 5-fluorouracil, they're all S synthetic phase specific. Which are G2 specific, G2 phase specific, bleomycin, etoposide, topotecan, daunorubicin, then which are M phase specific. Vincristine, vinblastine, paclitaxel, docetaxel, they're all M phase specific. You have all this anti-neoplastic story along with the notes in the onlinembbs.com video library. Take a chance today only to subscribe. Give a call to our helpline 9000 868 356 in order to get a subscription at a throwaway price. Now, doctor. Only Harsha Rajita correctly answered. I'm proud of you. Now, the alkaline drug imidopyrin is absorbed from where? From where? I'm sure all 4 of you will do this wrong. Because this is a niche Kamine question. Oh, one is able to answer correctly. I think that will be Zulfikar, I think. I don't know. Who is that? Oh, why is able to correctly answer this question? Abba, luck factor. Luck factor. Now, good to see Prabalika and everybody. After these 100 questions are over, we will take 1 hour voice break. You also enjoy a little break, and next 100 marathon will begin at 12:30 p.m. Okay? So please invite your friends also, and still you can use this link in order to join the quiz doctor, this 100 rupees link is payment link is still applicable for all the 4 games. So osteomalacia is caused by phenytoin. Oh, why did you say all? No, only phenytoin. Good to see 25 online. So I want you to click on this link, pay 100 rupees, call our helpline 900868 and join at least in the part 2 game 900868 So once you make the payment of the ticket, you will automatically get a mail where you can download an image. In that you have the links. Otherwise, you can give a call to our helpline who will provide you. Now, the next question, Doc. In carbamate poisoning, all this should be administered except which is not done in carbamate poisoning. Common question. Whoa, very standard question. So oximes are not for the carbamate but for organophosphate. A lot of times the house surgeons in casualty, they will not check OPR carbamate and then pump oxime to anybody. No, that's not right. Now, so once more, preventive medicine में एक बकवास लिस्ट रहता. What are the oximes? What are the OPs? You got to revise that. Dopamine. Why do you prefer in shock? Once more, Harsha will say very standard question. Why dopamine in shock? Good. What? None of you answered this correctly. I can't accept. Renal vasodilation makes dopamine preferable. It is a renal vasodilator. Oh. Now, Harsha, you did not answer. I'm surprised. Alpha-1 receptor action. How is it mediated? What is the secondary messenger or involved in alpha-1 receptor action? Yes, 2 of you are right. Calcium ions are involved. Once more, alpha-1, beta-1, beta-2, beta-3, alpha-2. Alpha-1 is vasoconstrictor. Alpha-2 is on the bronchial smooth muscle and lead to vasodilatation. Alpha-2 is in the brain, and any alpha-2 stimulation will be decreasing sympathetic outflow. Then beta-1 is in the heart, beta-2 is in the lungs, bronchodilation. So now, antibiotics which have neuromuscular blocking activity. What are they? All except. By elimination, you can walk out of this. Penicillin, doctor, penicillin. There is macrolides, aminoglycosides. You have to be careful, especially aminoglycosides. So once more, there's a dirty list, doctor. Usko ready ho jao aap. what are neuromuscular blocking, potentiating antibiotics का लिस्ट बनाना है आपके 200 पेजेस वाले नोटबुक में. So why Murali Bharadwaz is sitting here is to prepare you for the exam. Preparation for the exam is all about getting ready your list, your ammunition, your AK-47 when you are going for the war. You need to check how many bullets you are having. Are you ready with the bullets? Are you ready with the muzzle? Are you ready with the reflexes? Everything, right? So I always look at my students as snipers, warriors, scud missiles who are born to crack the top rank. Okay? So, doctor, very good, Rajita and Zulfikar, who correctly answered. Now, once more, breastfeeding में क्या दे सकते नहीं दे सकते, एक लिस्ट इधर एक लिस्ट उधर, सेफली गिवन, कॉन्ट्राइंडिकेटेड. वो दोनों लिस्ट आपके 200 पेजेस नोटबुक में जाना पड़ेगा. Very good. 4 of you are absolutely right. Theophylline, cimetidine, metronidazole, they are contraindicated. But they are not contraindicated. So, all of you correctly answered. Proud of you. Now, what is the disadvantage of the iodine as an antiseptic? So on this screen, you are not getting that clarity, doctor, but when you are playing it on your smartphone, you have a nice clarity like an actual online test. Okay? So, yes. Very good. 2 of you are right. Allergic reaction is a disadvantage of iodine as antiseptic. Now, 86 questions, 88 minutes. Almost it is taking 1 full minute for all of us. So when there is a respiratory acidosis, what happens? This is an interesting question, doctor, you have to be very sure about. In respiratory acidosis, hemoglobin is same, oxygen sat falls, partial pressure of oxygen falls, then how about anemia? Hemoglobin is affected, but oxygen sat in PO2 are normal in anemia. How about with hemoglobinuria? Hemoglobin is normal, PO2 normal, but oxygen sat is low. All these things you should be very sure. So if it is carbon monoxide poisoning, 100% oxygen is the treatment. If it is methemoglobinemia, you need to give IV methylene blue, treatment of choice, and vitamin C, ascorbic acid also has got a role. Now, doc, Jogrens, you should know all the serological antibody list. Good to see Geetanjali Chauhan, late but latest arrival. But don't forget Geetanjali, you can go to this link, pay 100 rupees, and you will get the link for playing this quiz. So you can join the quiz. So Jogrens is associated with punch, anti-SSB, absolutely. All 4 of you are right. But Harsha has punched before everybody else, scoring 91 points. 12 more questions before we decide who is going to be the topper of this quiz and get 40,000 rupees worth of online mbbs.com video library access. Full scale grant is 1 lakh PowerPoint slides of notes. Everything just by betting 100 rupees. Good, Harsha. Harsha or Rajita or Julfikar or Y? Who is that? Let us see. Anti-Smith antibodies, doctor. Only one of you is correct. Let me check who is that one. Oh, Harsha. So Harsha is only right in that. Now, Wiskott-Alvit syndrome. You should know all the features. Inheritance, which immunoglobulin rises, decreases. So you should be very sure. Wiskott-Alvit is X-linked recessive. Wiskott-Alvit platelets are deficient in surface CD43. Serum IgM is decreased, but Ig is increased. Please don't do a mistake in the tomorrow's exam. This kind of questions will cost you a life. Now, doctor, that brings Y to the top. Let us see which jockey is going to win the race in the last 10 questions left over. Let me see. Major basic protein. Where is it present? Major basic protein. All of you correctly will answer. Oh, none of you. Come on. I can't accept this. Eosinophil, doctor. Eosinophil. Oh, disappointing. But it's okay. It's okay. You need to go back, do revision. Sometimes very fundamental questions we will go wrong. But we should not be disappointed. You know, it is nothing to do with intelligence. NEET PG is not a genius intelligence IQ exam, unlike a IIT joint entrance or something. It's purely perseverance, willpower. Are you ready with the list? PAS positive cytoplasmic granules is a feature of alpha-1 antitrypsin deficiency. 8 more questions. Thinnest part of myocardial wall. What is that? Right atrium. Absolutely. Acid mucin. If you want to demonstrate what is the best stain for acid mucin, if you go to the previous AIMS exam, one of the stains is a favorite question. Alcian blue. You thought pass. No. Acid mucin is Alcian blue. Wow, Rajita is on the top, followed by Y, Harsha, Zulfikar. Oh, last 5-6 questions में पूरा जमीन आसमान ऊपर नीचे हो जाएगा. Let us see who is going to be the winner of 40,000 rupees. About medulloblastoma. What is true? Yes. What is the age group? Is it radiosensitive? It is a radiosensitive tumor, doctor. It is found in posterior cranial fossa. Why even one will answer this wrong? Oh. Most of you have gone wrong. Now, last 5 questions going to decide who is going to be 40,000 rupees winner. Target fibers in muscle biopsy. Where do you see? Target fibers. Where do you see? Yes, doctor. Not a single person answered this. Motor neuron disease, doctor. Now, the next question. Yes. So bone tumor, which is hormone dependent. Oh. So D is a good guess, but gone wrong. The last 3 questions. In pheochromocytoma, what is the indicator? Yes. What indicates that maybe this is a malignant pheo, which is typically seen in about 10% of cases. Vascular invasion, absolutely right. That keeps the domination of the Rajita, and Harsha is really struggling to reach out to Rajita. Now, last 2 questions before you bag that 40,000 rupees prize. Maximum deposits of lipofuscin. Where do you see? In which condition? Severe malnutrition. Good. 3 of you are right. That keeps Rajita going neck to neck with why? Oh, why miss this question? All right. The last 2 questions deciding who gets 40,000 rupees. The foreign body giant cells. How do you describe them? Where do you find them? How many nuclei? Are they central or peripheral? Come on, come on, come on. Oh, none of you could get that luck to answer this. If negative marking exam, you would have been clean board. So, 60 to 100 nuclei. Now the last question, is it Rajita or Y or Harsha? In the shock, come on, punch fastest answer. What is the characteristic feature? In shock, what is the characteristic feature? Is it cardiac failure, poor perfusion, cyanosis, edema? What defines the shock? Whoa! All 4 of you are right. Excellent, doctor. That keeps Rajita. Rajita, Rajita, Rajita. Very good. बहुत मजा आ गया. Excellent. So, those who are online, Pravalika, Dhanalakshmi, Geetanjali, Shreya, Tara Chand, everybody, thank you very much for participating. We will take 1 hour break and we will once more join back at 1 p.m. We thought 12:30, but we will give a voice rest and rejoin at 1 p.m. So those who could not be able to join the quiz, playing the quiz, can still do that by going to this link, make a payment of 100 rupees, and then immediately our helpline by themselves will call you and give you the link for playing the game. Okay, so have a great Harsha is asking, same score continues? No. Next marriage is new marriage. New wife, new house, new children, new mother-in-law, new father-in-law. No, don't worry about it, Harsha. But join on time from the beginning so that you will not miss out on the points and scores. Thank you very much. And Rajita, congratulations. Please call our helpline and you get 40,000 rupees of gift. Already, if you are our enrolled student, you can gift this 40,000 rupees coupon to any of your friends or your roommate, benchmate, classmate, reading roommate, anybody. Okay? So thank you all and see you at 1 p.m.